everyone, my name's Elsie. I'm the host of Birthing at Home, a podcast, and I'm doing a little series on how to have a home birth in Victoria because I'm doing a bit of advocacy for home birth in Victoria. If you watched my previous video, you'll know step one to having a home birth in Victoria is choosing whether you can have a publicly funded home birth or if you need to hire a private midwife. This is a video aimed at helping you decide on what questions to ask before you hire your private midwife. This is something that I'm actually pretty passionate about because I didn't really ask questions throughout my pregnancies. I asked questions for sure, and when things came up, sure. But if you plan on declining something, or if you don't know a lot about all of the testing and scans and all of the things within a pregnancy, you really should be asking questions, because if you do want to decline, sometimes that can jeopardize your home birth. So I went through on the Facebook group for home birth in Australia, and I looked at what other women suggest to ask, because I did not. And looking at some of these questions, I could have saved myself a lot of anxiety both times. The first question: are any tests compulsory for me to have a home birth? Like the glucose tolerance test for gestational diabetes. Keep in mind that in some cases you can decline the glucose tolerance test, the GTT, but they'll ask if you can have a HbA1c, which is an average, it's a blood test as well, or to do the finger pricking. But I would be asking what happens if you want to decline all of that. Will they still support you to have a home birth? Similar for question 2 is about scans. What happens if you decline a scan, all scans? Will they still support you to have a home birth? Question number 3, what is your policy for going over 42 weeks? As you may know, especially if you're a first-time mum, going over your guest date is very, very common and very, very likely. And it can become really, really stressful if you're 41 plus 5 and you know that your midwife is not going to support you after 42 weeks. Because what can you do? You just got to wait. So it's good to know what is going to happen if you go over 42 weeks. The 4th question is, what is your policy on vaginal examinations or doppler use during labor? The 5th question is, what is your policy on prolonged rupture of membranes? I did not ask this. I never thought it would happen to me, but it did. And it was a non-issue really, but I was not expecting it, and it was very stressful because I was told that at 72 hours, if I still had not gone into labor, my midwife would have to recommend that I go to hospital. They were happy for me to decline, but I was going to have to give evidence as to why I was going to be going against medical advice, and that was really stressful. I'm not sure if all midwives would be happy to prolong, to delay, things, or to accept somebody declining to go in to be checked or whatever if you have prolonged rupture of membranes. My waters broke and then I didn't go into labor for almost 3 days. So yeah, good to know. The 6th question is, if I need or want to transfer to hospital, can you support me? Some midwives can support you, but some cannot. If a midwife has admitting rights, they will be able to, but some midwives won't have that. It's also worth keeping in mind, if you need to have an emergency C-section or just a C-section that's not an emergency, would that midwife be able to also go to the hospital, go into the surgery with you? The 7th question is, what is your transfer rate and what reasons would warrant a transfer to hospital? Question 8, do you have a policy on the duration of labor or the birth of the placenta? In hospital, you do have rules around this. So it's really good if you can ask your midwife, do they have any? Are they happy for you to be in labor for 3 days? Are they not happy for you to be in labor for 3 days? Etc. And so also with the placenta as well. Are they happy to wait a couple of hours for the placenta to come? Are they not? Are they going to recommend the syntocinon if it's been 1 hour, 2 hours, whatever? Question 9, do you have set days off? If so, who would be the primary midwife if you gave birth on those days off, and can you meet them? That happened to me. And I didn't actually know that that was the case until much later in my pregnancy, and it was way too late to do much about it. Question number 10, can I know and meet who the second midwife will be before labour? So in Australia, the law says that you at least have to plan for 2 midwives to be present for a home birth. Of course, a baby's going to come when a baby's going to come. So if the first or the second midwife is not there, so what? But I actually didn't meet my second midwife until I was well and truly in labour. And I didn't know that that was going to be the case, because that wasn't the case the first time around. Question number 11, how long can you stay at the labour or birth? Again, in a hospital setting, there's shifts, right? In a home birth, it's quite different, and the midwife possibly can be a lot more flexible. However, it's also worth considering that you don't want a midwife to be there for like 24 hours on no sleep, and so you should ask, like, what is their policy or guide around that. Question number 12 is, how often can you support in the days and weeks after birth? How many appointments? Will they come to you? Will you have to go into a clinic? Question number 17. Question number 13. What would make me ineligible for a home birth with you? So in the publicly funded home birth model, they actually have like an appointment at 36 weeks to deem if you're still low risk enough for them. It's worth asking a private midwife, like, what would risk you out of being supported by them in a home birth, including the controversy around breech birth at home. I would be asking what they would do if they thought that the baby was breech, and are you happy with that? If not, maybe it's worth asking if other midwives would be different. Question 14, what are your episiotomy rates? Question 15, how would they respond to a baby that doesn't breathe immediately? It just might be handy to know like what the protocol is. I didn't, and in my first birth my baby did need a little bit of oxygen, and they cut the cord before that oxygen was being delivered, and that's something that I've still held on to for almost 4 years. So don't be like me and ask what they're meant to be doing. Ask what they will do, how they will respond. They will have done it before. Ask what they did. And question number 16, what is your policy on tearing in labour? Can your midwife, if you hire them, can they stitch 1st or 2nd degree tears? Or do you have to go to hospital for that? For 3rd or 4th degree tears, you would have to go to hospital. But are they happy to stitch a 2nd degree tear at home? Sometimes you don't need to be stitched at all, but still handy to ask. And finally, question number 17 is, can you offer sterile water injections for pain relief? If you don't know what sterile water injections are, I suggest you Google it. Personally, I knew what they were, so I never actually wanted them, so it wasn't important to me if I asked my midwife if I could have them or not. I do see sometimes women saying that they want gas, like the nitrous oxide, but I don't think that's like a very common thing for home birth midwives to carry. But if that's something that you want to look into before you hire them, is when you should be asking. I hope those 17 questions help. Like I said, it's not a definitive list. Pick and choose. I will list them below probably, but yeah, if you have any questions, make sure you also put in a comment, and if this video was helpful, please give it a thumbs up.